Hello everyone, I will be discussing the importance of childhood vaccine mandates and why they are essential for protecting children and supporting public health across all communities. These mandates play a critical role in preventing vaccine-preventable diseases. I will explore the policy and its impact at the individual, organizational, and community levels, discuss leadership styles that support implementation, examine workforce dynamics and community partnerships, and conclude with a personal reflection. This topic is especially relevant to nursing advocacy and public health in both urban and rural communities. Childhood vaccine mandates are state and local requirements for children, and the recommended vaccines, such as the MMR vaccine, are required before they can start school or daycare. As shown in the CDC map for the MMR vaccination coverage, there is a variation across the country. The main goal is to protect individual children from serious diseases and to achieve herd immunity that safeguards the entire community, especially vulnerable infants and immunocompromised individuals. Common requirements include MMR, DTaP, polio, and others. Most states allow limited exemptions for medical, religious, or philosophical reasons. In rural areas, maintaining high vaccination rates is critical because limited healthcare resources make outbreaks much harder to manage. These mandates directly impact patients and families. They protect children from serious diseases such as measles, which can lead to complications like pneumonia, encephalitis, or long-term issues including hearing loss and intellectual disability. They also promote herd immunity, safeguarding infants and immunocompromised family members. For families, this means less stress, fewer missed days of work and school, and lower medical costs from preventable illnesses. Overall, the policy balances parental concerns with evidence-based protection for children across all communities. At the healthcare organization level, vaccine mandates decrease the risk of outbreaks in pediatric units, emergency departments, and inpatient settings, both protecting patients and staff. They lower resource strain by reducing emergency surges and the need for isolation protocols. Nurses play a key role in leadership and education by scheduling and managing exemptions. Overall, these policies create safer and more efficient care environments in local hospitals and clinics. At the community level, these mandates maintain high immunization rates and prevent disease spread in all communities. As shown in the CDC bar chart for the combined 7 vaccine series coverage, the United States has maintained relatively high childhood immunization rates. This leads to improved child and population health outcomes by reducing the incidence of vaccine-preventable diseases. The mandates also strengthen public health infrastructure and reduce disparities in preventative care. Ultimately, they support broader community resilience by protecting schools, daycares, and local gatherings, allowing children to learn and grow safely in our communities. Leadership styles play a key role in supporting these mandates. Transformational leadership inspires healthcare teams to commit to prevention through education and a shared vision. Servant leadership focuses on addressing family concerns with empathy while upholding collective safety. Both styles are effective for advocacy and policy implementation by fostering collaboration and trust. They help overcome hesitancy and build public confidence in immunization programs for children. Leadership is key to driving change with childhood vaccine mandates. Leaders engage parents, schools, and providers through transparent and evidence-based communication. They overcome vaccine hesitancy with targeted education and empathy, helping ensure children receive the vaccinations they need. Leaders also address rural-specific barriers such as access and transportation. Overall, effective leadership facilitates policy success by building coalitions, providing ongoing support, and adapting strategies to local needs. Several nursing leaders have successfully influenced health policy in this area. Florence Nightingale pioneered prevention-focused public health reforms. School and public health nurses lead local education and compliance efforts for childhood immunization programs. Modern nurse leaders advocate for policy development and implementation of vaccine mandates. Their common approach is evidence-based advocacy, community focus, and collaboration. Workforce dynamics and collaboration are essential for success. Nurses play a central role in vaccine education, administration, and follow-up care. Interdisciplinary teamwork with physicians and public health professionals enhance coordination and improve compliance. This collaboration strengthens the response to vaccination outbreaks, especially in rural settings with limited staffing. Overall, these dynamics promote a positive workplace culture that supports policy goals and reduces burnout. Community partnerships play a vital role in supporting these mandates. Partnerships between local hospitals, schools, public health departments, and community organizations are essential for successful implementation. Joint immunization clinics and education campaigns help increase vaccination rates in both rural and urban communities. These collaborations overcome access barriers and build trust around childhood vaccinations. Overall, they strengthen community engagement and support sustainable public health improvements, particularly in underserved rural populations. To improve teamwork and partnerships, several practical strategies can be used. First, implementing school-based vaccination programs and automated reminder systems increase convenience and compliance. Second, providing family-centered and culturally sensitive education helps address specific concerns and supports vaccination for all children. Third, establishing shared tracking tools and follow-up protocols allows healthcare teams and partners to work more effectively. Finally, fostering ongoing collaboration and feedback loops continuously improves access and trust for these strategies. When reflecting on leadership influence, this assignment showed me how critical effective leadership is for successful policy implementation. Strong leaders ensure that mandates such as childhood vaccine requirements are carried out through education, support, and clear communication. They are able to balance policy requirements with the real needs of families, patients, and healthcare staff. Communication and empathy play a critical role in building trust and encouraging successful adoption of these policies, especially in rural health environments. Mason 2021 emphasizes effective leadership ultimately shapes the success of health policies through collaboration and adaptability. Reflecting on my personal growth, this assignment reinforced the importance of prevention and evidence-based policy in nursing practice. I am motivated to advocate for childhood vaccine mandates to protect children and promote public health in all communities. This project strengthened my understanding of my potential role as a future nurse leader and advocate. I am committed to helping children and the health policies and the importance of vaccinations as I complete my BSN and continue my career. Thank you for taking the time to listen to my presentation. I welcome any questions or thoughts you may have.